Lot of MBBS final year part 1 students who finished their ENT optal SPM, they requested to start final year subjects for them to attend along with the entrance going students. So we have changed the schedule, and from March 10th onwards we will be starting general medicine for 4 weeks, then surgery for 3 weeks, gynops 3 weeks, pediatrics 2 weeks and ortho 1 week. Then we will go with the remaining part of the schedule. So we declared that schedule and put it on online, mbbs.com, in another 24 hours, so that we will give notes in advance. So till March 10th we will have few more sessions of anatomy. It's worth listening any amount of anatomy from an illustrious teacher like Dr. Muralidhar Reddy sir, who is extempore in his knowledge and explaining the students. And we will have one more round of anatomy at the end of the session. So those who joining late will always have the cycle embedded. So yes, please ask them to upload the answers in Edmodo. Edmodo, that's good. Right, doctor? So uranium-238 longest half-life 4.5 billion years. Radon-222 shortest, which is 3.8. That is different from radium. You need to be quite sure. Generally, cartilage is considered to be a radio-resistant tissue, is what you have to basically remember. Now, cheapest question. Tomorrow's entrance also you will have this kind of 30-40 questions, which are very cheap questions, which is inhalational, which is intravenous, which is local anesthetic, etc., etc. Now, if you are correcting only dehydration, then normal saline is considered to be the fluid of choice. If there is an obstructive sleep apnea, how will a child will basically benefit? Most of the children with obstructive sleep apnea will benefit if you do adenotonsillectomy is what need to be you need to remember. Now, what is a live vaccine? This is an easy question. Measles classically is a live vaccine. This is a tricky question. Meningococcal meningitis. For how long do you need to treat? Lot of studies were done. Ultimately they concluded 5 to 7 days is the optimum treatment, is what need to be remembered. It is the mycolic acid. Acid fastness of TB bacillus is due to, is what need to be remembered. This is another important question, doctor. More than 10 mm you call MAN2 positivity. Even 5 mm also, when will you call MAN2 positivity? Is an important question. So remember, HIV infected persons, please tell Rajani to give Edmodo account details also to Rakesh, Krishna and Prasad and others, so that they will have an access to download the previous documents, PDF notes. Ask her to give the Edmodo account enrollment also. Now doctor, HIV infected persons, all our documents we will upload it into an account called Edmodo, which basically contains the PDF document library. From there you can download freely, you can circulate to your friends also freely, no problem. Now doctor, HIV infected people, recent contacts of TB case patients, and patients who are on organ transplant and persons with fibrotic changes on the chest radiograph. In all these people, even induration of 5 mm is considered to be positive, is what you have to basically remember. Of course, one small repetition happened. Primary focus is typically there in the liver. So that brings us to the end of the mock tests of this season, doctor.